A very good evening to everyone here. This is our first online event from SRC, and here we have Sushma M, Associate Professor from the Department of Pharmacology, to guide us to write our proposal for the ICMR STS project. Thank you so much, Ma'am, for helping out, and over to you.
Okay, thank you, Siri. I hope I'm audible.
Yes, Ma'am.
Okay, thank you very much. And guys, thank you so much for, I hope I'm not spoiling your weekend. We will start it, and I'm going to keep it very short. I'm going to tell you very briefly how we are going to write this ICMR proposal, because I was told that the first year also have some internal. So we'll try and finish in half an hour, and then we'll keep the discussion later. In case if someone has written and you have doubts, you can shoot it. The others can just stay for half an hour, write down all that important points I'm telling you, and then those who have internals can log out, then the others can continue with the discussion. So can we put the template, please? Okay, starting from ICMR, I think a lot of you have shown a lot of interest in ICMR this year, and it's been really amazing. I want all of you to write whether you feel it should be written or not written. Don't just go by it. Just write and apply. But at the same time, I just want to tell you, whether you get it or you don't get the ICMR acceptance, please complete your project and take it to publication. Until and unless you take it to publication, whatever you do is not, is a good thing. It's waste of resource if you don't do it. Take it to publication, and then once you publish something as a UG, doing your PG dissertation would be so easy. Just take it from me. We have seen for years. This experience is very, very good for your post graduation, and then you might get interested, and so many of our students are writing such lovely projects. So I hope you guys will not get disheartened if you don't get ICMR. If you get ICMR, well and good. If you don't get it, even that is very good, because you don't have timeline or anything like that, so you can just work and publish it. Okay, so we'll go through the template. Yeah, I hope this template is shared with you all. And I'm sorry, that top bit is called Rajiv Gandhi University of Health Sciences. This is the one which we write our synopsis for postgraduates. And I just want all of you to note down, it is the same format which you will be submitting to our ethics committee, institutional ethics committee, or BMCRI. But what you will do is you will take out Rajiv Gandhi University pro forma for dissertation and all that bit, and you will say project proposal for institutional ethics committee clearance, BMCRI. Okay, institutional ethics committee clearance, research proposal for institutional ethics committee clearance, BMCRI. Okay, you are going to write that as topic. This we do for our postgraduate synopsis, and all of you please save this template in whichever college you go. This template is very, very useful. All my undergraduates have gone all over India, keep calling me and taking this template, because it's a very good framework in which you can fill up. And more or less your ICMR also follows the same bit. Okay, so can we scroll up and go to the topic? Okay, right. So title of the topic first, you all are going to decide a title. My advice to you is, you start with any title. Just write one title and start writing your document. Once you finish writing your proposal, you will write a better title. So, and always write 4 or 5 titles and ask your friends or ask your guide which is better. Just don't write only one title. Write one title to start with, and at the end of the document, obviously you will revise your title, and it is the headline which catches the eyes of the reviewer first. So it has to be very, very good. Your title is, the face of the document, so it has to look very good. Some points what you all have to understand is, one, always write your primary objective. A part of your primary objective becomes your title. Your primary objective becomes your title. Okay, and then second point is, don't write any fancy ones. Okay, some kids previously had written tale of two drugs and all that. Okay, so you don't have to write such fancy things. A pill for every ill and things like that. It need not be rhyming and like English essay. Okay, so don't worry about all those things. It need not have to look fancy and catchy and all that stuff. It is a scientific document which you are writing, so you cannot write any adjectives. Okay, so you please keep that in mind. You cannot write saying it is a very good drug, it's wonderful. Okay, so those kind of words you cannot write. You have to write in very simple language, and it is a scientific document. So what does your title contain? In case if I give you an example, paracetamol for fever. Okay, so I feel that yes, the drug is there and I'm going to give it for fever, so I'm doing the research. Okay, so that is a very half information what you are giving through your title. So if then think about another title which, so the same title, how you are supposed to write is a comparative study to analyze the efficacy of paracetamol versus ibuprofen in reducing fever in children with community acquired pneumonia. Okay, did you understand? So this is like your primary object. You are saying in your title just paracetamol for fever. We don't know who is the population. Are you giving only one drug, or are you comparing it with something else? And what is the design of your study? Nothing will be there in your title if you just want a catchy title like paracetamol for fever. Okay, so you write it's a cross-sectional study. To what am I going to do? I'm going to analyze the efficacy. Okay, efficacy or safety or effectiveness, anything you can write. Efficacy of paracetamol versus ibuprofen in reducing fever. Who is the population? Among children with community acquired pneumonia. Okay, so are patients with community acquired pneumonia. Okay, so it has a design and it gives you the proper objective why you are going to do the study and who is the population. So if your title is a little small, you can say at a tertiary care center. BMCRI is a referral center, so at a tertiary care center you can write, but avoid writing in India, in South India, and things like that. Okay, so we are not the only hospital in India or South India. Please don't say such things. And it is not a multi-centric study or anything like that. It is done in one hospital in Bangalore. So you are allowed to write at a tertiary care center, but don't write in India and in South India and in Asia, things like that. Okay, right? I hope all of you have understood this much. So it has to be very informative, and don't make it very long. Short meaning I'm not saying very short, but don't make it too long, and no ambiguous term and no catchy terms and no question marks. The title cannot be a question, and no adjectives. Keep it in very simple English. Okay, I hope majority of you have got this. Okay, so shall we continue? Are you really understanding it? Siri or somebody can just answer me.
Yes, ma'am.
Yes, you are through. Okay, fine, fantastic. We'll go to the next section, which is your introduction. I don't think in ICMR it's called a brief or resume of intended work. One sec, I'll just open. Siri has sent me what is your ICMR thing. What is it called? Let me just open that. I think it's just an introduction. Okay, it's just called an introduction. So kids always understand introduction has to be, it is only 300 words, I think they allow. So split and your introduction has to be very, very good. From the title, if the reviewer has got some interest in your title, next he will see your introduction. So ideally what we are going to do is we are going to divide our introduction into 3 paragraphs. Okay, 3 paragraphs of uh, just keep it as 100 words each paragraph. You need not have to really follow 100 means 100 on tala. You can even write 60 to 70 and more in the second paragraph. But briefly, I just want all of you to divide your introduction into 3 paragraphs. Okay, first when you are writing. First paragraph, you have to just say what is the disease burden and epidemiology. Say, for example, I'm going to take the study on diabetes. I'm going to say what is the disease burden of diabetes in India, especially globally and also in India. And because of diabetic complications, we are losing out so many, economic importance of that and things like that. Okay, so the DALY and all those things will come. So basically, you are going to say, why is my topic so important, and why is it so important in my country and this and my hospital? Okay, so that, as I told you, in case if I'm doing something in diabetic neuropathy, I'm going to say India is a diabetic capital, and 30% of all our diabetic patients are ending up with diabetic neuropathy in 10 years. And then we are spending a lot of our money on treating this diabetic neuropathy. So you've given the importance of your disease and its burden, global statistics and Indian statistics in your first paragraph. In the second paragraph, you always have to write what is the current knowledge known to us and what are the gaps in the knowledge. As I told you, if I take diabetic neuropathy, then I'm going to say, so diabetic neuropathy, we are giving amitriptyline, which is the drug of choice. And then what are all the other, you can start with any other analgesic and then give tricyclic antidepressant like amitriptyline. Then you have to come to gap in the knowledge. Here you can quote a lot of guidelines. There are a lot of scientific bodies like American Heart Association or JNC guidelines for diabetes, American Diabetes. We all follow for diabetes, American Diabetic Association. Okay, so you can say that American Diabetic Association recommends using amitriptyline as the baseline drug, and later, if the patient is not responding, we can go to other drugs like duloxetine or something like that. And then, what is the gap in the existing knowledge? See, if I am comparing two drugs here, amitriptyline versus gabapentin, then I'll tell what are all the problems with amitriptyline. Then I'll tell amitriptyline is causing sedation, amitriptyline is causing urinary retention in elderly. So even though it is very efficacious, safety wise, we need a better drug. And so in the market, we have a new drug called as gabapentin, which is not causing all these reactions. Okay, so you can quote some of the other studies which have told all this, that amitriptyline had all these problems. So that is the gap in the knowledge. Okay, so and third is all about your justification that why you are doing this study in this hospital. Okay, or why you are taking this study and what is the real importance of it. So in the third, in case of this study, you are going to say, because of the safety issues in elderly, amitriptyline cannot be used in all the population, and about 23% of them are not responding, and it is causing excessive sedation. So we are going to compare gabapentin with amitriptyline and see its efficacy as well as safety issues, as this kind of study has not been done in India so far. So head-to-head comparison will provide us whether gabapentin is as efficacious as amitriptyline, and whether safety-wise elderly are very happy with this drug. Okay, so going back, first paragraph, you are going to say what is the disease burden. If you are taking diabetes, then you are going to say the global epidemiology of diabetes, and then you're going to say Indian epidemiology, and you're going to say that 30% of all the diabetics like become diabetic neuropathy or suffer from diabetic neuropathy in about 5 to 8 years, and the pain is never controlled, and the response to any analgesics is, the success rate of analgesics ranges between 10 to 40% in India. From other studies you have to quote. Okay, in the second paragraph, you're going to say currently this Indian Diabetic Association or American Diabetic Association, they recommend a particular treatment, but over the years we have seen these problems with the treatment, and we are looking for a new drug. So gabapentin is a newer drug which has come to the market, and it is safety has been established in the previous trials. But from India, we don't have any studies. So the justification would be there are no studies which compare head to head. We call it one drug with one another drug, or one surgical technique with another surgical technique as head to head comparison. So it's a, we are moving to the problems seen with amitriptyline, and we want to hypothesize that gabapentin would be both efficacious and safe as compared to amitriptyline. Hence, the present study has been undertaken. So you have to write that reason why you are going to why you are doing this study, and why is this very important. So that third paragraph is the most important paragraph, where you are going to justify the study. Okay, not everybody, not every study, you just cannot say that this study was done in America and not in India, so I want to do this study. Okay, that is not a real justification unless we have that pharmacokinetic problems or anything like that. See, now if you want to take a study of atorvastatin daily versus alternate dosing, then we can always say it has been proved that Asians, especially Indians, require alternate dosing of atorvastatin is shown to be enough. So the practice, clinical practice, is to give it every day, but people are coming up with insomnia and some muscle pain if they take it daily. So we want to try alternate regimen of atorvastatin, and we hypothesize that it could be much safer compared to daily atorvastatin, and it would be a cost effective benefit to the patients. So that would be your justification for doing this study. So your patient is going to take less drug, and it is also going to be uh, improvement in his finance. He's not going to spend that much on the tablet. So daily atorvastatin versus alternative atorvastatin. So that would be your justification. Okay. So and then always quote the references as superscript and start in proper chronological order. The first paragraph you start with 1 and 2. Keep at least 3 or 4 or up to 5 references in your need for the study, or in your introduction. Okay, and stick to about 300 words. This template what I'm showing you is Rajiv Gandhi synopsis for postgraduates, but follow 300 words, I think, is what is given to you for plus 100, 300 plus 100 words you can. Uh, ICMR allows you to do introduction, so you can write a good amount of information. So hope this is. Did you understand this, or you want me to repeat, or shall we go forward? Can we go forward?
Yes, ma'am.
Okay, right. I think review of literature is not there. Shall we go to objectives? Okay, just go to the objectives. I think objectives, keep two. Please keep only two objectives, because it's very difficult if you keep third and fourth objective to achieve. So just keep two objectives and follow the SMART criteria. Okay, that Prashant sir taught you in research methodology class. It should be specific, it should be measurable, it should be ethical and things like that, and time bound and relevant and achievable. Okay, in that I always say M is most important. It should be measurable. And objectives of the study, children, first, a person like me, if I'm reviewing any research proposal, I see the title and I jump to the objective. Okay, I jump to the objective and then I go back to introduction. So your objective, I would say, is the heart of the document. If the objectives are wrong, if I see the first and second objectives are completely wrongly framed, and then I will have no interest in reading your proposal. Okay, objectives are the most important step, and follow the SMART criteria. It should be specific, measurable, achievable. It should be relevant, and it should be time bound. Okay, so they are giving you 1 or 2 years time, so you should be completed in that time. So how do we know whether I can complete in that time? You have to do a pilot study by going to our hospital and seeing how many patients come a day and whether I can finish it. Not if you want 100 patients, they won't come in a month. Okay, so every day, or if you are going on alternate days, they may come on. You may get 1 or 2 patients in the OPD, and that too you have to go after your um, what is this, classes are done, SGDs are done. So look into that part also and take some studies which are very feasible in our hospital. So coming to objectives, As I told you, your objective should contain three parts. I told you this in the research methodology class also. One first most important thing is action work. The second is the content, and third is condition, we say, or population. Remember it as population. So going back to my paracetamol thing, uh, the action verb is to compare. Okay, the action verb I'm using in this objective is to compare what is my content, efficacy and safety of paracetamol versus ibuprofen in reducing fever. Okay, who is my population? Children with uh, community acquired pneumonia. So I have all three parts. Action verb, if you have two, if you are comparing two drugs, if you are comparing two techniques, it is going to, the action verb is always compare. What are the other verbs? Please make a note of this, children. What are the other verbs which we can use? It can be estimate if you are doing any biochemical things, biochemistry things, estimating serum uric acid and things like that. So it can be estimate. Second, it can be analyze, or it can be to evaluate. Most commonly used action verbs are, if you are doing a comparative study, it is compare. Otherwise, it is usually to analyze, to assess, or to evaluate. Okay, and if you are estimating something, you can estimate also. Okay, these are most commonly used. Please do not use the terminologies like I want to know if paracetamol reduces fever in children. Okay, to know is not measurable. To understand, how do we measure understand? Okay, it is not measurable. Don't write to know, to understand, uh, to study, and then to prove. Things like this are completely a big no. You cannot write it. Okay, cannot write that in objectives. So your action verb should suit the study and the study design. So if you're having two groups, write compare. Otherwise, use the words estimate or analyze, or as I told you, assess and evaluate. This is the most commonly used. And then if you have written something else, then we can have a discussion on that. And then condition is, if you are comparing, as I told you, I want to compare the efficacy and safety. So both I want to see whether how effective it is in reducing temperature, and safety is adverse drug reactions. I'm going to monitor adverse drug reactions. If I'm taking two surgical techniques, then I will say I want to compare the effectiveness of two surgical techniques, this versus this, some two techniques among patients with hernia or something like that. Okay, patients, and don't write here psychiatric patients, diabetic patients. Okay, you cannot name them like that. You're going to say patients with diabetes, patients with psychiatric illness. So that is your population. So you can easily have your verb and your population. In between, you have to, in a line, in a few words, you are going to give out the essence of whole study in your objective. So whenever you write the action verb, content and population, and start filling in there, and then you can make a proper objective. So once you make your objective, you can take that and make it your title also. So your objectives are the heart of the document. It has to be measurable. And your objective, once if you have written your objective, cut it into three parts and see whether all three parts are there. So which are the three parts? Action verb, the content, and the condition. Okay, so objectives are very important. Please put in a lot of effort in identifying which is your, writing your objective. Okay, so shall we move on to materials, methodology? Shall we move on? Okay, fine. Right. So if you have any doubts, I think after this we'll go ahead. Methodology, please write, see the slides here. Source of the data, you can write the OPD or inpatient or wards in Department of General Medicine in Victoria Hospital attached to Bangalore Medical College and Research Institute. So you can write the whole thing. And method of collection of data, you need not have to write these smaller headings. You can write it as a paragraph also. but make sure you have all this information. Then study design. Okay, so whenever you are going to write, I'm going to compare between this surgical technique and that surgical technique, or this drug versus this drug. When you use the word uh, compare, you have to do a comparative study, which is randomized controlled study only. Okay, if you are trying to identify, so I told you this in research methodology also, your objective and your study design should match. So if there is mismatch between your objective and your study design, okay, your whole study is gone. It is not right. And because we always see at the end whether your objective, study design, and conclusion, all these are in line. So you decide on your study design properly when look at your objective. If you are trying to identify a risk factor, it has to be a cohort study or a case control study. Cohort is a prospective study and case control is a retrospective study. If you are going to do a case control study, matching is very, very important. So you're going to identify. So if we go back to the famous example of smoking and lung cancer, if because from smoking to lung cancer takes years together, and if we cannot follow up for years together, because here again we have time constraints, then we are going to do a case control study. So you have patients with lung cancer. So outcome has happened. So what is the outcome? Lung cancer. So we are going to take patients with lung cancer and patients without lung cancer. So lung cancer patient is a case and he should be matched to a control who has no lung cancer. So don't just, you cannot just match only age and gender. There could be a lot of other factors which influence it. Maybe people where they stay, if they are inhaling a lot of chemicals and things like that. So geographical area also has to be matched. Then you are going to take everybody. If I'm selecting people from Bangalore as case, I'm going to select people from Bangalore only as control. So this is one example. There are a lot of things which you may have to do matching if you're doing case control study. Cohort is a simple prospective study. You can just define who's the population. Make sure here outcome should not have happened. So in smoking and lung cancer, which is the exposure? Smoking. What is the outcome? Lung cancer. So we are going from smoking towards lung cancer. So that is exposure to outcome. In a cohort study, there is, you are going to take people who had exposure and no exposure, so smokers and non-smokers, and go ahead and see in time whether how many of them developed lung cancer. But in a case control study, outcome has happened. We are going to see how many had an exposure. So you're going to take guys with lung cancer and you're going to ask them, did you smoke? How long did you smoke? How much were you smoking every day? That is why there is, they have to recall everything and tell you. That is why case control studies usually have some sort of recall bias. And cross sectional study is a snapshot study. Like if I want to know what is the prevalence of obesity in Bangalore, okay, or what is the obesity, what is the prevalence of diabetes in Bangalore, okay, it is more or less called as prevalence study or a hypothesis generation. It's most easier to do because you see the patients only once and there's absolutely no follow-up. So that is cross-sectional study. So remember, if you are comparing, it has to be a randomized control study. If you are trying to identify a risk factor, it has to be cohort or a case control study. Or if you're just trying to identify some frequency or prevalence of something, then it can be a cross-sectional study. Okay, and very carefully choose your study period. Can you just scroll up something? Study period I have just written there, but for you I think it will be a little different. Um, Okay, right. And place of the study we have already mentioned, which hospital in Bangalore. And sample size, I think you had an introduction class by the statistician. And even that is very, very important, children. You have to write the proper formula. I think Vishwanath gave you lots of formulas. If it's cross-sectional study, it is different. If it is a cohort study, then it is different. If you're using means, it is different. If you're using proportions, it is different. So you cannot be going and asking statistician which is the formula for this. Okay, you have to search, and he's given you all the formulas. You read your articles and decide which formula you're going to use. See your design, and then what are all the values which you are going to add there. So you have to write your formula in your document, and you have to put in all the values, substitute all the values, do all the math, and then give the ultimate sample size, and then put in some extra people for dropouts or missing data. And if you are picking up the proportions or standard deviation or means from a previous study, you have to give the reference of that previous study. And this section is very, very important. Don't just say, I have done a pilot study and only 30 patients come every month, so I'm going to take only 30 patients. And the study is for 1 year, so 30 into 12, I'm going to take, 360 people. You cannot be writing that. You have to calculate using a formula only. Okay, so go back to all the references which Vishwanath gave you and go ahead and write calculate the sample size, calculate the dropout rate, and come up with the proper sample size. Okay, and coming to inclusion criteria, write the age, whether you're going to include children or you're going to include elderly. So you choose the age properly. If it is, if your study is only elderly, then you say above 60 years. Okay, so if you do, it's only in adults, then you say between 18 and 60. Or if it is in children, you can say from 5 to 18 or something like that. But you should have a proper number and proper explanation for why you are choosing that age. And everybody can write patient willing to give informed consent. And along with this template can be shared in our club actually. And then informed consent is given, the BMCRI informed consent is attached with this template, and everybody can use that. And whatever you write now, if my study is in diabetes, then you cannot just write all the patients diagnosed as type 2 diabetes mellitus are included in the study, but you have to write all the patients diagnosed as type 2 diabetes mellitus based on American Diabetic Association guidelines. If you are taking hypertensives, then you are going to say, I'm going to include all the patients who are hypertensives according to JNC 8 criteria. If I'm going to take patients with pneumonia, then I'm going to say chest X-ray confirmed pneumonia patients, okay, or ultrasound confirmed DVT. So something, whether whoever recruits, whether you recruit or I recruit, we are going to recruit the same patients, same similar type of patients. So that's why writing the criteria is very, very important. Based on what you are calling your patient as diabetic, or based on what you are calling your patient as hypertensive. Somebody might have diagnosed him as diabetic, but we are going to follow American Diabetic Association and see whether his HbA1c is more than 7, and then only take him into the study. I hope I'm, you guys are understanding it. And exclusion criteria, please don't look into your parent article and list everything starting from thyroid and liver, kidney disease, okay, and autoimmune disease and things like that. Okay, the screen is off, is it? Samya?
Yes, ma'am, just a minute.
Okay, fine. Exclusion criteria, just don't write anything and everything. Usually we say, if you are using any drug, one of the most important thing to write is if the patient is hyper sensitive to the drug. Or you can also say, usually we do not take pregnancy and lactation, and unless the whole study is about gestational diabetes and things like that, we can take pregnant ladies. Otherwise, pregnancy and lactating mothers are always excluded, and patients who are hypersensitive to the study medication will be excluded. Okay, and then if in your patients, if you do not want liver disorders, then you should have a right reason why you are writing it as liver disease or thyroid disease or heart IHD, heart disease, and things like that. So make sure your exclusion criteria are proper. And how do you get these exclusion criteria? One is by reading a lot of articles, and secondly, you have to do some pilot studies before writing. At least you have to take data of 10 patients, then you will know what you are writing. So exclusion criteria could be good there. I mean, you can choose the right ones. Okay, can we get it back? Still a problem?
Just a minute, ma'am. There's a
Yeah,
network
go on.
error on her side.
No problem. I think we are exceeding time. Okay, after exclusion criteria, I think the template is shared in the group. I guess. So what we are going to write is a methodology. You all have to say after obtaining approval and after obtaining, and please follow these sentences, children, and you can write the same in your document. After obtaining approval and clearance from institutional ethics committee, the patients fulfilling inclusion criteria will be enrolled into the study. Okay, or after obtaining informed consent, which is given as annexure 1. And if you are taking children, there is something called as an assent form. I'm not going to get into the details of it, so you can just look into what is an assent form if you are taking children into your study, and parents will of course write the informed consent. Okay, and then case record form is something with a follow-up chart, and I have attached that as an annexure. We can just quickly go through it later. Write the study groups and details about how data will be collected. It's like you will go to the OPD and then how you screen the patients and take them into your study. And sampling method, and if there is blinding, then you can I think and how do we randomize? If you are doing a randomized study, you have to write the whole method of randomization. You can say randomization according to the www.randomization.org. This computer generated sequence through this randomization website will be taken. Okay, and then you can write the flow chart showing. Can you show the flow chart? Flow chart showing how the study is going to go, starting from how the patients give written. Can we put that on the screen? Just scroll. We have the flow chart. Can we have the flow chart on the screen? And it is a must actually. Write how many patients according to your sample size. N is equal to sample size. If it is 100 patients, then we'll assess them for eligibility, then take the informed consent. The study period is 18 months. Then we start the study. In the baseline only, the clinical variables which are listed will be taken down. And then you can write if you have a follow-up period of you're going to see your patients once in 3 weeks, and AM in 4 weeks and 8 weeks, then you can write when the second follow-up will be after 4 weeks, and then we will be noting down these variables in 4 weeks. Then at 8 weeks again the patients are going to come back and I'm going to see these variables, and at the end after 8 weeks we'll enter the data and appropriate statistics will be done, and at the end study will be terminated. Okay, so this flow chart is very important, right, according to whatever is your follow-up period. And then coming to assessment tools, if any of you all are using questionnaires or scales or anything, please make sure that it is free to use and list those assessment tools here. And now, most important is outcome measures. Outcome measures, you can write it here or in objective also. See, when I told you I'm going to compare the efficacy and safety of paracetamol versus ibuprofen, or paracetamol versus a new drug, then efficacy parameters will be the temperature. What are the what is the clinical outcome? We will see clinical outcome in reduction in temperature in 2 hours, or number of patients in whom temperature reduced by 2 degrees from baseline within 1 hour. Okay, so that will be your efficacy parameter. So outcome in diabetic neuropathy, if I'm looking at pain reduction, then we would have asked them what is your pain at the baseline. If the person had told 8, if I give the drug by 4 weeks, the patient at least should say 50% reduction in the pain. So when he comes for my first follow-up, I'm expecting him to say 4 at least. So from pain score, 50% reduction in the pain score is my efficacy parameter. And what is my safety parameter? I'm going to ask whether my patient has any dizziness or any adverse drug reaction. In surgery, it would be any surgical complication. Okay, if I'm comparing two surgical techniques, my efficacy parameter will be the number of hours, reduction in number of hours. Okay, if one technique was taking 4 hours, my new technique takes only 2 hours to perform. So one will be what is the time taken for surgery. Second, length of hospital stay. If my patient goes home fast, then I would consider it as a successful surgery. Okay, third would be time taken for my patient to mobilize. Okay, so compared to one technique was patient was taking 5 days, my newer technique the patient is walking in 2 days, then that is considered as success. Okay, so if you are looking at in case if you are taking some medication and seeing whether or if you are thinking that you are going to introduce one exercise regime and seeing the blood glucose before and after, then you will say reduction in FBS by 50%. Okay, or reduction in HbA1c in 3 months by at least 1%. That would be my efficacy parameter. Okay, and I hope it's a little difficult to understand, but if you read more and more articles, you will get it. And baseline, so I mean, statistical analysis, I think all of you can write down the first paragraph. Everybody does the same baseline demographics and clinical data. It is descriptive statistics. And then as I think the statistician has already told you, if you're comparing two groups, you're going to use t-test. If you're comparing more than three groups, you're going to use ANOVA. If you're trying to identify the predictors or factors which influences something, then we can do chi-square test, or a little further, you can go on to a logistic regression. Okay, I think we will be using only t-test, ANOVA, and chi-square test as of I know. So let's stick to those tests and write the proper test. If you have not written, you cannot write, and we are going to choose appropriate statistical test later. Okay, some of the students write that it's a very wrong way of writing it. Write your specific uh, statistical test. And how will you know it? You read your parent article properly, and if your methodology is almost the same, then you will be doing the same. And any doubts, we are always there, and if you want to do any additional statistics, we can help you out. Okay, and after that is the reference in Vancouver style. Shall we just go scroll down to that reference in Vancouver style? Okay, I think there is Zotero and Mentley and all that, which helps you out in writing this journal article. But I just want all of you to note down how a journal article is written. Uh, the last name becomes the first name of the article of the author, and his first name becomes H. If my name is Sushma Muraraya, okay, then S Muraraya S becomes my in your Vancouver style. Okay, so your last name becomes, you have to write the last name and the first name becomes the initial. Okay, right? And then what's the easiest way of doing it? Just go to PubMed and say that site. It will give you in Vancouver style. But just know it, just check it. Um, you cannot write the full name of the author. His last name is written and the first name is written. If he has three names, middle name also becomes an initial. Okay, so you're going to write only the last name and everything else becomes initial. You can write up to 6 names of the author. After that, you're going to say et al. Okay, and then after et al is a full stop, and then you're going to write the whole title of the article. Okay, albendazole in neurocystic sarcosis, and then full stop. And please see British Journal of Clinical Pharmacology. I have not written it full. I have written BR gap J space clim pharmacol. Okay, it is an international abbreviation, and you have to write only international abbreviation. You cannot write British Journal of Clinical Pharmacology full. You have to, in Vancouver style, you are going to write only the abbreviation which is internationally accepted. It's not an abbreviation given by me. It is an internationally accepted, and you go to the journal, they would have given the proper abbreviation. Okay, so after that is a space and year. It was published in 2011. After that is a semicolon and volume. Okay, if there is an issue number, you can put a bracket and write issue number. Then there is colon, page number 77 to 84 and a full stop. And chapter in a book, I think I'm not going to explain to you. It's a little complex. You just go through that. This is the Vancouver. Majority will take from journal article. Chapter in a book, you have to write who is the author of the chapter, the name of the chapter. Then you are going to write the names of all the editors. Then Nelson Textbook of Pediatrics, which edition, volume, okay, who is the uh, publisher, then year and page number. And please see this. We should, any author would know, any reviewer would know how to write in Vancouver style. So don't make that kind of mistakes in your document. Okay. right? And I think that's let me just check whether ICMR asked for something else also. I think it is implication, which is very, very important. How is it? Okay, what is the implication of your study? Now, in case if we are comparing, as I told you, amitriptyline has a lot of problems, so I'm looking at gabapentin. Then you have to say the implication is one, it would be this study might identify a very, safer option in elderly, a safer drug in elderly because gabapentin may not cause urinary retention. Number two is this drug could prove to be a cost effective treatment. Third, and my study, this study will provide evidence towards making policies. Because of my study, the hospital may buy the drugs and give it to the elderly patients with diabetic neuropathy. Okay, or if I'm saying two surgical techniques and my surgical technique takes very less time and it doesn't require antibiotics and patients can go home, then you are going to write that as your implication. So this study might generate data towards this alternative technique, which not only saves time in the surgery but reduces the anesthesia required and also reduces the economic burden on the patients as they can mobilize and go home, can get discharged faster. So that is implication of the study. So you are, what data you are generating from your study, how is it going to help the population, or how is it going to help your hospital? My hospital may make any policy based on my study, or how it is going to be very, very helpful, especially if your population is children or elderly, then how is it going to be very helpful? That is the implication, and this implication is also very important. Word it properly. Okay, and I think that's all. We took a little extra time also. Is there anything which you want to ask me? And
Excuse me, ma'am, one thing.
yeah.
Ma'am, I think in the ICMR STS proposal, the student details or the institutional details should not be mentioned anywhere in the proposal. So I think we
Oh,
should omit the part there.
okay, which place of the study and all that, I think. Or do we give it and they retract it or something like that? No, no.
No, ma'am, we don't
Yeah,
mention the
then.
details of the student or the
Okay.
institution in the proposal.
Okay, right. Please, and you don't have to write what is the place of the study. You can just say the study will be done in Department of Medicine or Department of Psychiatry, inpatient or outpatient. Okay, that's a very valid point. Okay, anything else, Siri and others?
Ma'am, I think if anybody has doubts, they can ask.
Yeah, you can switch
Preferably,
on the mic, children. I'm unable to access your or you can read out Siri if there are anything on the comments.
yes, ma'am. I think we can take the doubts from first years and later go on to the others because they have
Yeah,
exams and they can read. So if any first years have questions, you can ask. Okay.
I think when you
So there is
start writing it, you'll get a lot of doubts.
one question in the comment box. If we are doing a study
Okay.
which compares pre-operative and post-operative changes following the surgery, will it be a prospective study or randomized control trial?
Pre and post, it is the same study, no? It's just a comparison. You
It's a
cannot
comparison.
randomize because it is just a comparative study because the subjects are the same. We are just doing pre and post. Okay, you cannot randomize because there's nothing to randomize here. It's only one group study, right?
I hope, Cyber, you got your question answered. Anybody else?
Okay, any of the second years have some doubts? We can just go through
Ma'am,
that
I
to
had some
finish the
doubts.
session. Yeah, go ahead.
Ma'am, you mentioned about in introduction we should mention the disease epidemiology, ma'am. Like if it is a CAP, then we should mention the epidemiology of CAP, ma'am. But what if in
Coming to
our
acute
study,
pneumonia,
yes, ma'am. So what if in our study there is nothing about a disease, but they are doing the studies on a heart disease or lung disease? Then what should be the introduction, ma'am? Should we mention the common diseases and in the bracket write their epidemiologies, or what would you suggest, ma'am?
okay, it is very specific to what your study is about. So what we meant is, in a broader sense, we want to make sure that the document says what is the disease burden, so that the study which you are doing gets the importance of it. So if it is like 3 million people are suffering from pneumonia every year, then doing this study is going to help indirectly 3 million people. So that's the importance of the study. So it is not a must that you have to give all this, but you make sure you give importance to the disease in which you are working, so that people know the burden of it. If the whole study is about economic burden of something, then you can say how much the patient is suffering and losing out and things like that. So how your study is important. Okay, it's very study specific.
Ma'am, one more thing, ma'am. In the topic you mentioned about cross-sectional study, ma'am. So,
Yeah.
if a study is clinico-pathological study or like such a study, ma'am, is it necessary to mention that in the topic, or can we
It is
mention it
not,
later, ma'am?
no, no, it's not, it's not a must, but it makes the title look good and full. It gives a lot of information. So it is not mandatory, but if you write, then it gives full information.
Okay, ma'am. Ma'am, one more, ma'am. What is the difference between the study type and the study design, ma'am? Study design is a cross-sectional descriptive study, ma'am. But there is always also a small heading in the ICMR PDF, ma'am, that they are told to write about your study type. So, will it be clinical investigation or what will it be, ma'am?
Study type they have given. What is the explanation they've given for that?
Ma'am, 2 minutes.
Is it like prospective, retrospective, something like that they're expecting? I think they just mean the same.
They have in methodology they are given that describe the procedures and justify the study design, and this may include type of study and study design like that they have mentioned, ma'am, for that reason.
Okay, I think just mean the same, and maybe the design with logistics, whether you are going prospectively or retrospectively, something like that.
Okay, so like over there we can write prospective or retrospective study.
No, you just write code. I think study design should be sufficient.
Okay, ma'am. Also one more thing, ma'am. In exclusion criteria, if we are excluding the pediatric group, ma'am, should there be some specification, or can we just write that we are excluding
No,
the
no,
pediatric
no,
age
no.
group?
There's no need for any reason to be written. You can just say that pediatric population is excluded. But what I meant was, don't just copy everything from the parent article. You should know the reason why you are excluding some patients, and then it should be very relevant to your study. If your drug is not doing anything to thyroid, and I cannot be just writing, I'm going to exclude all patients with thyroid and things like that. When I know specifically my drug is not going to do anything to thyroid, then why should I exclude them? Okay, so don't write random exclusion criteria.
Okay, ma'am. Thank you, ma'am.
Okay.
Anybody else has any other doubts?
Okay, any other doubts? I'll be available in the department. I think it's pretty late on the weekend. I
Yeah.
hope not that many doubts are also there, I guess. Okay, once you start writing, I think you will get a lot of doubts. So we can have a follow up of this and look through it. And I think Prashant sir has given some shared IEC letter also, which can be used. So we can go ahead with that. And okay, hopefully, I hope that you guys got some idea about starting writing your proposal. And any other doubts, I'll definitely be available in the department. Okay.
Thank you so much, ma'am, for taking your time to help us with the proposal. I think any doubts, like if anybody has, that will be shared on the group, and it helps everyone else.
Yes, Siri, that's a very good idea. So you just put it on the in SRC, and I think whenever I have time, I'll start answering it in the group.
Yes, ma'am. Sure. Thank you so
Okay,
much.
good night, everybody. Thank you, Siri, and thank you, Samyam, for the slides and everything. Have a nice weekend, children. Good night, everybody.
Good night, ma'am. And guys, also you can follow the ICMR website for the guidelines or any other recent announcements that will be made. And don't shy away from putting your doubts on the ICMR STS. If anything is there, the seniors are also there. They'll help you out with the proposal submission. And if it is not answered, it will be forwarded to the teachers. Sushma ma'am and everybody can help it out. Thank you so much, everyone, for joining.